Today we're tackling a topic that affects millions of adults every day: stiff knees. I'm one of those. As we age, or even if we're very active, our knees can start to lock up and feel tight. This can be frustrating, painful, and limit your mobility. So let's break down why this happens. The most common cause of stiff knees include osteoarthritis, or the natural kind of wear and tear of joint cartilage, inflammation from overuse or repetitive activity, past injuries like torn ligaments or meniscus issues, excess weight putting extra pressure on those poor joints, poor circulation, muscle imbalances, or even changes in the weather. Understanding why your knees feel tight is the first step towards relief. And today, we've got 11 real-life remedies you can use to help regain flexibility and reduce discomfort. Heat. Heat therapy is great for stiffness. Use a heating pad for 15 to 20 minutes. Take a warm bath, or wrap your knee in a warm towel. This is especially helpful for morning stiffness or cold weather discomfort. You could try sleeping in rice, but actually for swelling or flare-ups, try RICE therapy, R-I-C-E. That stands for rest, ice, compression, and elevation. Nice, easy way to remember that. Ice for 10 to 15 minutes at a time, and never directly on the skin. And don't sleep in a rice bed. Building strength around your knees reduces strain. Think straight knee leg raises, mini squats, wall sits, hamstring curls, and glute bridges. Always go slow to avoid sharp pain. Those are some pictures of all those exercises. Stretching your quads, calves, and hamstrings and hip flexors daily improves flexibility, easing pressure on those knees. Eat foods that fight inflammation: salmon, berries, leafy greens, turmeric, ginger, olive oil, nuts, and seeds. And unfortunately, limit those sugary, fried, or especially those ultra-processed foods, loaded with inflammatories. Even losing a few pounds can make a big difference. Every pound lost reduces about 4 pounds of pressure on your poor little old knees. A brace or compression sleeve supports alignment, reduces stiffness, and increases confidence while moving. For temporary relief, medications like ibuprofen, the anti-inflammatories, acetaminophen, or topical creams can help, but I do caution you, don't overuse those. Now here's a big one. Sitting too long with knees bent makes them stiff. Stand, straighten, and stretch every 30 to 45 minutes to keep those joints loose. That's something I live by. When stiffness is severe or persistent, physical therapy, injections, or in rare cases, surgery might be needed. A specialist can guide you through the right treatment for you. Remember, knee stiffness is common, but it's not something you have to just live with. With these remedies, from home care to professional treatments, you can keep your knees flexible and reduce discomfort. Hey, tomorrow on UroNurse News. Not on UroNurse News, on UroNurse tomorrow. UroNurse News is over. Only Monday through Friday. So, tomorrow on UroNurse, nurse practitioners are changing the landscape of healthcare. Join me as we explore how NPs are empowering patients, driving independence, and improving access to care. Learn how their expertise is transforming everyday healthcare experiences. Don't miss it tomorrow on UroNurse.com. I'm Vic Senese. Thanks for watching all week on UroNurse News, and don't forget to like and subscribe, and see you next week for some more stories.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view.
UroNurse News.